Okay, my name is Heather Cook and I am a patient at Brackendale Medical Centre. I'm going to be talking to you today about my experience of integrated care from an overseas accident back into primary and then lots of kind of community services that I had and my secondary healthcare as well, and I think I have quite a good positive story to tell. In December, late December, I was skiing in France and had quite a serious accident where I broke my tibia plateau. Had surgery in France with very little information given to me about what the treatment would be, what the prognosis would be, what the rehab would be. So I was in a bit of a confused state about what this injury meant. I was eventually flown home just after New Year. And in advance of me arriving, my husband had been in touch with Brackendale Medical Centre to say that I was coming back, and could they manage the transfer of my care into the orthopaedic department, because we knew that we needed to have quite a special intervention with this type of fracture. So I got home. Challengingly got home and was kind of expecting to have an appointment on the doorstep waiting for me when I got home, but I had to wait a few days. I got in touch with the practice, Dr. Barron, who said I was a bit concerned that I was still waiting for an appointment to come through from Fracture Clinic, and I know that she'd been in touch with them with the referral. Eventually it did come through, but it was for a couple of weeks' time, which for me was far too long to wait because I had so many unanswered questions. I didn't really know what and how and when I should be doing things. Plus I was in significant amounts of pain as well, so I knew I needed to be seen, and I had a blood clotting problem, a pre-existing problem, which I needed to manage. Anyway, clearly the practice had got back onto the Fracture Clinic, and that afternoon I got a phone call to say that my appointment would be tomorrow. Went to Mr. Johnson's clinic, who's a knee surgeon. Had a fantastic service there. The films that I'd brought home with me weren't good enough, so I had same-day CT scans again of my leg, which gave him a better picture of what to do. He actually had told me that I might have to have more surgery, which was greatly worrying because I'd already been chopped up once before. And actually on Friday evening, I think it was 8:30, 8:45, he actually called me and put my mind at rest to say that I wouldn't be having any surgery. He didn't want me to worry over the weekend, which was a really great touch, made me feel a lot better. In the middle of all this secondary healthcare support, I had a steady stream of community healthcare people that came to visit that had all been coordinated fantastically well. I had a large wound on my leg with 30 odd staples, and I have a house which is a Victorian house, not really designed for disabled living, which is what I realised I was going to have to endure for the next few months of my life. No downstairs toilet, very long staircases, no easy access in and out of the house, a shower that one has to step into to get it. There's all these challenges that I didn't really know how to tackle. So when the occupational therapist turned up that Brackendale had organised, I was delighted, and she was fantastic. She assessed my house very quickly, worked out exactly what I needed with regards to aids, grab rails, toilet raises. I found it very hard to put my own socks on, which was a bit humiliating for me because I had to go and ask someone to help me with my pants and my socks. So she taught me how to do that, which was just fantastic. She came back a couple of times to support me, just to check everything was okay. The district nurses were always on time, took my staples out, dressed my wounds. Again, I felt they were as in concerned about my mental health as my physical health, just checking that everything was okay. Even Dr. Barron phoned me a couple of times on a Friday just to check on how I was doing. Not really used to sitting down, not going out at all during the week, so that was a really lovely touch. I had to take warfarin for the duration of my injury until I got back to normal active duties. And again, that whole warfarin clinic service just was so accommodating to, not to my needs obviously, but to the needs of my primary carer, my husband, because I couldn't drive myself around anywhere. So the fact that it's around the whole of Stockport and there were clinics available every day to go to, we were able to work with the clinic to determine which would suit my husband's work best. So if he needed to make, if 8:30 on a Monday morning was the only time that would really suit him, then that's when I'd have my appointment. And that was just a really lovely touch as well. So taking in the needs of the carer as well as the patient, that was great. The practice itself, there was a number of times where we had to make phone calls around getting repeat prescriptions for medication, for painkillers and warfarin. Again, single Margaret, the receptionist out there, could not have been more accommodating and friendly, and you really felt that everyone was on your side, which was fantastic. I eventually got discharged after about sort of 10 weeks of care. And again, another thing I'd just like to point out is a safeguarding thing. So I was told to stop taking my warfarin, and so I didn't turn up at the next appointment that I had in my diary, and the safety net immediately kicked in. I got messages about my failed appointment, then I got a letter about my failed appointment, and then eventually my GP called me to see why I'd not turned up, which was fine because I didn't have to go anymore, but again, I just felt there was a really good safeguarding element of that. So I think it's a story of, we hear lots of stories about people complaining, but for me, it's been a great example of how joined up healthcare can work really well. And I feel really blessed to live in this area, and I feel really, thankful to everybody that took part in my rehabilitation.